Hello, I am Dr. K. Raghu. I am a specialist in blood diseases practicing in Coimbatore at Arunodaya Medical Center, which is located in Goodshed Road near the railway station. Now today we are going to talk about blood diseases in general, whether we can prevent some of these blood diseases and what are the various treatment modalities for various blood diseases. You must know that blood is a very precious and a very wonderful product of nature that circulates in our body when we are alive. We have about 5 liters of blood in our body, and this goes on flowing throughout the entire body, and it has got so many different functions. The blood has got various blood cells, namely the red blood corpuscles or the RBCs, the white blood corpuscles or the WBCs, and the platelets, and also a lot of fluid substances called plasma, various proteins like coagulation factors, like hormones, like enzymes, and so many other very important substances. But the wonderful thing is that when we are alive, when the body, when in the living state, the blood is always in the fluid state. It doesn't clot at all. But when it comes outside the body, when you get a small injury, the blood immediately clots within about 5 or 10 minutes. So this is also a very, very important factor, because if the blood does not clot when we get some injury, then we will lose all our blood from the injured area. Now blood can be, of course, blood can go wrong in many conditions, so to say, and cause a lot of blood diseases. And there are very common blood diseases which are there all over the world, and some of them are very common in countries like India. So there are different blood diseases which can happen in the human body. Some of them are common all over the world. Some of them are more common in India, because we have a very large population with a lot of malnutrition and poor eating habits. And some diseases are also common because they come through the genetic mechanism, that is, it comes from the parents. So the most common blood disease in the world is anemia. Anemia means that there is a reduction of hemoglobin, which is the oxygen carrying protein in the blood, and this causes a variety of symptoms like giddiness, fatigue, fainting, lack of energy, difficulty in breathing, leg swelling, chest pain, so many different symptoms. And so these patients will go to their family doctor or to their regular doctor with all these complaints, and we do a lot of tests to find out why they have got anemia. Because to treat the anemia properly, we require to have a definite diagnosis of the cause of the anemia. That is very important. And these patients will require sometimes a bone marrow examination, endoscopies, colonoscopies, a scan test, blood, and some special tests in the blood. The most common cause of anemia in India is because of lack of nutrients, of lack of substances like iron, like folic acid, and also protein. Now all these three are very important for formation of the blood, and these are sometimes not present in our diet. Especially if they are pure vegetarians, they tend to get more anemias because of nutritional factors. So we advise our patients to eat a nutritious diet. We also give them treatment by way of injections or tablets containing these various medicines, and also we advise them to take iron-rich food, which can be all types of meat, green vegetables, dry fruits, dates, oats, soya, sprouts, black sesame, fenugreek, palak, etc. Diet rich in folate will be eggs, yeast, lentils, lettuce, spinach, and beans. And protein rich foods are cheese, eggs, milk, soya, meat, peanuts, nuts, cereals, lentils and pulses. Now we should know that we have different blood groups in our body. Each person has got a different blood group, and there are basically 8 blood groups, A, B, AB and O, and in every type of blood group there can be a negative or a positive factor. That's called the rhesus blood group. So one person can be O positive or O negative, can be A positive or A negative, they can be AB positive or AB negative, or they can be B positive or B negative. So these are the major blood groups. There are also other small groups or so-called minor blood groups that are not very important for day-to-day information or day-to-day awareness or day-to-day management. So these blood groups are important because when you require blood transfusion or when somebody requires to be given blood, we have to give the same group blood to that particular patient. That is why we need to know our blood groups always, because it can help you if there is an emergency of any type. Now, blood cancer is a very important and also a very scary topic for anybody. Now, many patients, when they come to us, when they come to me, they come in a very disturbed state of mind because their doctor or somebody has told them that maybe you are having blood cancer, just go and get your blood tested. So blood cancer is also called as leukemia, and there are many different types of leukemia or blood cancer. Nowadays, because of the tremendous advances in the medical research, we have been able to defeat many of these leukemias, but at the same time, not all leukemias can be cured with modern treatment. In the case of children, the leukemias are definitely curable. At least about 80% of leukemias in children can be cured. Even in India, in the Western world, in the advanced countries, it is more than 95%. Now, what are the main symptoms, or what are the main complaints with which a patient with leukemia will have? The most important thing is fever, which will be there for a long time, more than 3 or 4 weeks, and will not respond to any of the commonly given treatments. Secondly, they could be having some bleeding problems, bleeding in the mouth or in the nose or other parts of the body. They'll be losing a lot of weight over a very short period of time. They may have lumps in the neck or in the abdomen or somewhere in the body, and sometimes they can have severe pain in the body, in the muscles, in the bones, etc. Now we find out leukemia by doing very simple blood tests, and by looking at under the microscope, in this microscope, when you look at a blood smear, we can see the abnormal cells, which are called the leukemic cells. And we also do tests like bone marrow tests and some special tests to find out what type of leukemia the patient is having, because every type of leukemia has got different treatments and also different kind of survival possibilities. So this is a very important topic, and if you have any of these symptoms, then it should not be ignored and you must go to the doctor immediately. There is a very rare type of cancer, not very rare but not very common also, called multiple myeloma. Now this kind of cancer occurs usually in people who are above 50 years of age, but I have seen many patients much younger than 50 years, sometimes even 35, 40 years. Now these are tumors which occur in the bone marrow, and these tumors usually cause severe bone pain, and sometimes fracture of the bone can happen. They can have kidney failure, they can have severe anemia, and so many other rare complications. Now myeloma is important because in the last 10 years there are a lot of new drugs have come, a lot of new medicines have come in myeloma, which are almost enabled us to cure myeloma in many patients. And we also do what is called as bone marrow transplantation in multiple myeloma, to give a better chance of cure in myeloma patients. Now, myeloma has got again so many different types, and some of the myelomas affect the kidney very often, and they may require to be given dialysis and other kinds of therapies. Transplantation myeloma has really improved the chances of cure of myeloma, and today a patient of myeloma can live up to 10 years or at least 10 years or more, whereas in the olden days not more than 2 or 3 years was the usual survival time for myeloma. I mentioned in the beginning that some of the blood diseases are transmitted from the parents, so that comes via the chromosomes or the genetic mechanism. And in our country, especially in this part of India, we have a very interesting condition called sickle cell disease, or sickle disease as we call it. This disease is very common in the tribal population of Nilgiris. It is also found in many other tribal areas in India, in so many different parts of India. Sickle disease is important because it is not a curable problem, but we have got very important treatments for sickle disease today. Now, these patients will usually come with anemia. They will come with yellow coloration of the eyes called jaundice. They will also get severe pain in the body, in the bones, etc. And they have a variety of problems like gallbladder stones, like cardiac diseases, like softening of the bones, bone necrosis, kidney problems, etc., etc. Now, this disease can be diagnosed even when the mother is pregnant, in the pregnant stage itself. And if it is diagnosed at that stage, then we can prevent the birth of a sickle baby by giving them proper advice about terminating the pregnancy. It is also important to do genetic counseling for these patients, because many of these conditions are occurring because in the community they marry within the same family or among very close relatives. So-called consanguineous marriages are taking place, and this is the reason why sickle disease is still very common in India, in certain parts of India at least. There is also a condition called thalassemia, which is like sickle cell anemia, a genetic disease. Again, here the hemoglobin is not formed properly, and they also can have severe anemia, jaundice, and they require to be given blood transfusion regularly for the rest of their lives to keep them alive. And when you give blood transfusion regularly, they get iron accumulation in the body, and that has got to be cleared with special drugs which are called chelators, which can prevent iron accumulation in different parts of the body. So I tried to give you some idea about some of the common blood disorders or blood diseases which we see in our practice, and I strongly advise people to have regular blood checkups. For example, go to the doctor or go to the hospital and get yourself checked completely regularly, because many diseases can be diagnosed much before they actually cause symptoms. For example, diabetes, like hypertension, etc. And also, if you are in good health, make it a habit to donate blood regularly, because blood donation is one of the very important things which as a healthy person you can do to the society to save a life, and also to see that patients who require blood do not suffer for lack of blood.